Good afternoon, guys. I've got discussion A for you. Give me 2 seconds to set up for the show, and I'll be right with you, please. Let me get my papers in order. Okay, we're discussing America's aging, and it's not ready for aging population to grow yet. So, here we go with the presentation I made for you. Please enjoy. Okay, here's a concise summary of the key points from the article. America's aging, and it's not ready, researchers warn. Aging population and infrastructure gaps. A study by Northeastern University highlights that the U.S. is unprepared for the growing aging population, lacking adequate infrastructure and policy supports. Many communities, especially in states like Arizona, have up to 70% of high aging areas without sufficient senior services. Uneven access to services. Access to essential services like healthcare, transportation, and grocery stores varies widely. Example: in Flint, Michigan, residents' input on water quality shaped infrastructure priorities and rebuilt trust. Culturally responsive engagement. Tailoring outreach to reflect language values and historical contexts of diverse communities. Avoids one-size-fits-all solutions and honors community wisdom. Use storytelling, visual tools, and myth busting to make technical concepts accessible. Some regions offer decent support, but others face critical deficiencies, creating logistical challenges for older adults. Personal motivation behind outreach or behind research. Lead researcher Ryan Wang was inspired by observing his own family's struggles with aging related logistics, such as simple errands becoming a major hurdles. Related insights. Florida's aging paradox. A separate study by Senior Lee found Florida ranks worst for aging in place, despite its reputation as a retirement haven. Issues include give me a minute, guys. High housing costs, limited access to home health aides, frequent weather hazards, poor emergency care timelines. This piece underscores the urgent need for policy reform, equitable service distribution, and community based solutions to support aging populations. Given your work in participatory design and culturally responsive frameworks, this could be a powerful springboard for co creating localized interventions or myth busting toolkit. Want to explore how we might adapt this into a community engagement strategy or policy brief? Absolutely. The infrastructure gaps highlighted in the Northeastern University study are both systematic and spatial, meaning they stem from policy neglect and uneven geographic distribution of services. Here's a deeper breakdown. What infrastructure gaps really mean? These gaps refer to absence, uh, absence or inadequacy of physical, social, and service-based systems that support older adults in aging safely and independently. The study identifies several key areas. First area, healthcare access. Many aging communities lack nearby clinics, hospitals, or specialists trained in geriatric care. Long travel times and limited public transit may make routine care difficult, especially for those with mobility issues. Transportation deficiencies in rural areas or rural and suburban areas, public transit is sparse or non-existent, leaving seniors dependent on private vehicles or costly ride services. This affects access to groceries, pharmacies, social activities, and medical appointments, housing, and built environment. Few Few communities offer affordable, accessible housing with features like ramps, elevators, or proximity to services. Zoning laws often prevent the development of multi generational or senior friendly housing clusters. Social community services. Services like meal delivery, caregiver support, adult day programs, and social engagement hubs are unevenly distributed. In states like Arizona, up to 70% of high aging communities lack, lack sufficient senior services, emergency preparedness. In places like Florida, frequent weather hazards, e.g., hurricanes, expose seniors to risk, yet emergency care timelines is poor. Infrastructure for evaluation, sheltering, and medical response is even not senior specific. Why this matters for equality and policy. These gaps aren't just logistical, they're deeply tied to social detriments of health, especially for marginalized older adults. Without targeted investment, we risk increased isolation and preventable hospitalizations, higher caregiver burden and burnout, widening disparities and aging outcomes across race, class, and geography. Given your expertise in participatory design and culturally responsive frameworks, this is a prime opportunity to co-create community-level audits or mapping tools that identify and address these gaps. Want to sketch out a prototype or toolkit concept together? Here are several compelling examples of infrastructure improvements that have meaningfully enhanced aging support systems, each offering lessons in participatory design, sustainability, and equity. Portland, Oregon, water infrastructure rehabilitation. Challenge: aging water system dating back to the early 20th century caused frequent leaks and water quality issues. Strategy: Portland used predictive analysis and community engagement to prioritize upgrades. Outcome: water loss from leaks dropped by 30% 5 years, improving reliability and public trust. London underground tube improvement plan. Challenge: one of the world's oldest metro systems face safety and efficiency issues. Strategy: systematic upgrades to tracks and stations and signaling integration of hold on. Yes. Smart monitoring and sustainability initiatives. Okay. Outcomes: significant reduction in delays and disruptions with improved passenger satisfaction and operational efficiency. Hoover Dam structural rehabilitation. Challenge: aging concrete and seepage, threatening long-term sustainability. Strategy: targeted structure repairs and a modernization of monitoring systems. Outcomes: extended lifespan and enhanced safety of critical national infrastructure assets. Four, community-led upgrades. Various U.S. cities. Examples: cities like Minneapolis and San Francisco have piloted age-friendly neighborhood redesigns, including accessible sidewalks and transit stops. Intergenerational housing models, localized service hubs, co-designed with residents. Impact: increased mobility, reduced isolation, and stronger community cohesion. Why these matters for aging equality? Next sheet. Each example reflects multi-sector approach, combining technology, policy reform, and community voice. They show that aging infrastructure isn't just about concrete and pipes. It's about dignity across and autonomy. Would you like to sketch out a framework for adapting these models to rural or underserved communities? We could co-create a toolkit that blends these lessons with your myth-busting and participatory strategies. Rural infrastructure improvements must be tailored to sparse populations, geographic isolation, and limited local resources, while still honoring cultural and community strategies. Here's a breakdown of the most applicable and impactful strategies. Mobile and telehealth expansion. Why it matters. Rural areas often lack nearby hospitals or specialists. Solutions: mobile health clinics that rotate through underserved regions. Telehealth platforms with broadband subsides for older adults. Training local caregivers to facilitate virtual visits. Impact: reduces travel burden and improves chronic disease management. Flexible transportation networks. Why it matters. Over 90% of rural trips rely on private vehicles. Solutions: demand responsive transit, e.g. dial a ride services. Volunteer driven programs with mileage reimbursement. Regional coordination of medical transport. Impact preserves independence and access to essentials like groceries and appointments. 3. Age-friendly housing profits retrofits. Age-friendly housing retrofits. Why it matters. Many rural seniors face housing affordability and accessibility barriers. Solutions. Grants for home modifications, e.g., ramps, grab bars, uh, ins- insulation, incentives for accessory dwelling units, ADUs, or co-housing. Local zoning reforms to allow mixed use and intergenerational housing. Impacts enables aging in place and reduces institutionalization. Broadband and digital literacy. Why it matters. Connectivity is essential for telehealth, social engagement, and emergency alerts. Solutions. Public-private partnerships to expand rural broadband. Community tech hubs and digital navigator programs. Impact bridges the digital divide and supports autonomy. Cross-agency collaboration. Why it matters. Rural areas often lack centralized services. Solutions. Okay, guys. Joint planning across health, housing, and transportation and social services. Civic engagement initiatives to co-design age-friendly strategies. Impact builds resilient uh, ecosystems that serve all generations. These improvements align beautifully with your participatory, culturally adaptive approach. Want to co-create rural aging infrastructure audit or toolkit that blends these strategies with with myth, with myth busting and community wisdom. I'd love to help you sketch it out. Rural infrastructure improvements must be tailored to sparse populations, geographic isolation, and limited local resources, while still honoring cultural and community strengths. Here's a breakdown of the most applicable and impactful strategies. Mobile and telehealth expansion. Why it matters. Rural areas often lack nearby hospitals or specialists. Solutions: mobile health clinics that rotate through underserved regions, telehealth platforms that with broadband subsides for older adults, uh, training local caregivers to facilitate virtual visits. Impact: reduces travel burden and improves chronic disease management. Okay. Uh, flexible trans flexible transportation networks. Why it matters: over 90% road trips rely on private vehicles. Solution: demand responsive transit, e.g., dial a ride services, volunteer driver programs with mileage reimbursements, regional coordination of medical transports. Impacts: preserves independence and access to essentials like groceries and appointments. Age friendly housing retrofits. Okay, why it matters. Many rural seniors face housing affordability and accessibility barriers. Solutions: grants for home modifications, ramps, grab bars, and insulation, incentives for accessory dwelling units, ADUs, or co housing, local zoning reforms to allow mixed use and intergenerational housing, enables aging in place, and reduces institutionalization. Why it matters. Connectivity is essential for telehealth, social engagement, and emergency alerts. Joint planning across health, housing, and transportation and social services. Civic engagement initiatives to co-design age-friendly strategies. Impact: builds resilience ecosystems that serve all generations. These improvements align beautifully with your participatory and culturally adaptive approach. Want to co-create a rural aging infrastructure or toolkit that blends these strategies with myth busting and community wisdom. I'd love to sketch it out. Community Communities can play a transformative role in infrastructure planning when engagement is uh, intentional, inclusive, and sustained. Here's a framework of strategies that empower residents, especially older adults and marginalized groups, to shape the systems that serve them. Participatory planning workshops. What it is, facilitated sessions where community members co-design solutions with planners, engineers, and policymakers. Why it works, builds trust, uh, surfaces lived experiences, and fosters ownership. Example, in Detroit, residents helped redesign public parks to reflect cultural values and accessibility needs. Community led audits and mapping. Okay. What it is, residents document infrastructure gaps, broken sidewalks, inaccessible transit stops, using mobility tools or paper surveys. Why it works, creates hyper local data that planners often miss. Examples, California's Strategic Growth Council partnered with advocacy groups to map underserved communities that lack basic services. Ongoing feedback mechanisms. What it is, digital platforms, town halls, and listening sessions that allow residents to weigh in throughout the project life cycle. Keeps project responsive and adaptive to evolving needs. Best practices, compensates community members for their time and expertise, especially elders and caregivers, for people that are disabled, so they can use the same areas that everybody else uses. Modifications matter, guys. All right. The next thing is partnerships with trust local organizations. What it is, collaborating with faith groups, senior centers, cultural associations, and grassroots coalitions. Why it works, these groups are embedded in community and can mobilize participation more effectively than government alone. Okay, last page, guys, for the A. Want to co-create a template for community engagement that integrates these strategies into aging infrastructure planning. We could build equity matrix, culturally adaptation prompts, and caregiver-centered design principles. Now, guys, there's a reason why I did this show tonight or this afternoon. This first one was to explain why local governments need to adapt spaces for aging populations to access them just like regular people. But they need to be able to access it like a normal person does. So that is why I did today's A for you this way. So With that being said, if anybody has any questions, comments, concerns, leave it in the chat below for me, please, and I will see what I can do about getting you answers for that. Okay, I'll be back on shortly with B. Give me a bit for B, please, and I'll be back on with you. For now, Gator Wellness, take care, folks.